Okay guys, here's a question on isolation precautions. You should know these for your NCLEX exam. These are usually covered in fundamentals courses. This is a chart I found online, and it has the 4 types of isolation precautions. It also has the diseases that are used for each precaution, and it has the PPE that are required for each one. So let's go over these real quick. For standard precaution, patients who are under standard precaution are all patients. And the nurse or healthcare provider for standard precaution would wear gloves and perform hand hygiene. Next is contact precaution. Contact precaution should be used for MRSA, C. diff, RSV, and scabies. And the healthcare provider would wear a gown and gloves. Next is droplet precaution. Should be used with flu, mumps, rubella, pertussis, and the healthcare provider would wear mask, gloves, and gown. Last is airborne precaution. Should be used for TB, which is tuberculosis. You have to know that abbreviation because it may be on your NCLEX like that. Tuberculosis, measles, varicella, and COVID-19. The PPE that would be used by the healthcare provider is an N95 mask that is specially fitted with a fit test at the hospital, and a negative pressure room. This chart also has PPE donning and doffing rules, the order that PPE is taken on and taken off. With tuberculosis, the negative pressure room is used as an isolated space. It maintains a lower air pressure than in the surroundings. In other words, it forces the outside air to flow inward when the door is open. Then that traps the infectious particles or contaminants inside. These rooms are used in hospitals for infection control and safety for the patient. In other words, there's going to be an isolation precautions sign on the door. It's going to tell you not what the patient has, because that would be a HIPAA violation. It tells you, it may say do not enter. It may say please see the nurse's station. Every facility uses something a little different, and it may have the PPE hanging on the door on the outside, so you can put on your PPE before you even walk in the room. But as students going into your clinical settings, check with your clinical instructor, because you may not be permitted to enter those rooms as a student. You may not be permitted to enter special isolation precaution rooms. And when you walk in, there is an anteroom. First, you're going to see an anteroom. It's like a little storage area, and it will have the PPE stored in there. And then there's going to be a second door to the patient's room. So if that second door or first door or second door are opened, that negative pressure room forces those contaminants to be forced inside to the room, and not the outside environment where you're exposing. Keeps those contaminants from exposing people on the outside of the door. So because the pressure inside the room is lower than the hallways, the air always rushes into the room rather than out into the rest of the facility. So the key here is to not only protect the patient, you're also, with TB or these other diseases, infections, your aim is to protect the outside, people on the outside. Other patients and healthcare providers should be protected with these precautions. Okay, so let's go on to the question. The nurse is caring for a client with active pulmonary tuberculosis, abbreviated TB. The client requires airborne precautions and is receiving multi-drug therapy. Which of the following precautions should the nurse take to transport the client safely to the radiology department for a chest x-ray? Okay, and I'm going to read these answer choices. Number 1, ask the x-ray technician to come to the client's room to obtain a portable x-ray. Number 2, have the client wear a mask. Number 3, notify the x-ray department that the client requires airborne precautions. And number 4, wear a filtration mask and gloves during transport. And I'll give you a minute to think about this and we'll come back. I'll let you know what the correct answer is and I'll go over the other answer choices and the rationales. Let me take this opportunity to quickly just recommend, if you're enjoying this content, to like and share and subscribe to my YouTube channel, which is Nursing with Hart, PhD. Okay, let's go back to this test question. Okay, so let's go through the choices. So you have a patient who has active TB and they are under airborne precautions at a hospital facility. They're also getting multi-drug therapy. Which of the following precautions would the nurse take when transporting the client safely, right? Safety is always the priority, to the radiology department for chest x-ray. All right, let's go with, and the correct answer is number 2, have the client wear a mask. When the client has a communicable disease and they must leave the room, it's important to protect everyone who they come in contact with. Having the client wear a mask protects others from the airborne particles should the client cough. Okay, number 1 is incorrect. Number 1, ask the x-ray tech to come to the client's room to obtain a portable x-ray. Okay, asking the x-ray tech to come to the client's room, the client may leave the room as long as the nurse initiates the appropriate precautions. Number 3 is incorrect. Notify the x-ray department that the client requires airborne precautions. With number 3, this is an essential action that the x-ray department should be aware that the client requires airborne precautions, but it doesn't address the precautions the nurse should take to provide safe transportation. Okay, so that one's incorrect. Number 4 is incorrect. Wear a filtration mask and gloves during transport. This action protects the nurse, but it doesn't protect the other people on the way to the radiology department. Okay, so the correct answer there is number 2, have the client wear a mask. All right, and that's it for this one, and keep an eye out for the next one. All right, have a great day. Bye now.